yourself out. Now, as our team is getting adjusted, I'll introduce myself. Hi, my name is Mercedes Amador. I'm the Director of Student Engagement and Retention here at the College of Health Solutions. Thank you for joining us today. Today's session around health disparities, more specifically the Hispanic Latinx Paradox, is a topic that we've chosen because it's close to Hispanic Heritage Month. We, had some scheduling woes, but here we are. And we wanted to make sure that this semester we took a look at a community that we, as individuals within the community and future practitioners, future doctors or healthcare providers or innovators, an opportunity to expand your horizons and the things that you are exposed to as you go through your academic career with us here at ASU. Last year we language is hard for me today. We tackled some other topics, and then we discovered a little bit around ethics and mindfulness in health and healthcare last spring. And so should you find yourself intrigued to find out more about population specifics or any sort of, I don't know, I've never been exposed to this information, therefore I'm going to dabble everywhere that I can. Know that you can find all of our content on our CHS, or the College of Health Solutions, YouTube page. I'll send a follow-up email with all of those details so that you can stream and see what we've done during the pandemic and then now moving forward for access. That being said, as I get a couple of other logistics taken care of, I do want to take a moment to acknowledge the fact that we are on Indigenous land. So Arizona State University, Tempe campus, and the downtown campus sits on the ancestral homelands of our Akimel Oda Odom and our Peeposh Maricopa peoples. So thank you so much for joining us today. Know that we are excited to have you. We have some great panelists to discuss Latinx and Hispanic paradox. I will take the moment to go ahead and introduce you to our great moderator and our wonderful panelists. Let me just shift gears 1 second. All right. It's my honor to introduce you, Dr. Swapna Reddy. She is a clinical associate professor at Arizona State University at the College of Health Solutions. At Arizona State University, Dr. Reddy teaches students in undergraduate and graduate coursework. She serves as faculty at Arizona State University Barrett, the Honors College. Additionally, she is adjunct assistant professor in healthcare administration at the Mayo Clinic Alex School of Medicine in Arizona. Dr. Reddy was recently named as a Fulbright specialist. Get you a practitioner that can do everything, apparently. Dr. Reddy's primary research interests are how law and policy can be utilized as tools to improve population health and health outcomes, reduce health disparities and inequities. She has presented at various international, national, and local conferences and published on issues related to healthcare of high-need populations. Dr. Reddy regularly comments to the media on issues related to health policy and disparities and has a monthly Reddy Health Policy news segment on Arizona's PBS Arizona Horizon show and is a co-host on Arizona PBS topical news show Break It Down. She has also been featured on BBC, PBS, NPR, KJZZ, and NBC News, Bloomberg News, Phoenix Business Journal, ABC 15 Phoenix, Cronkite News, and ASU Now. Prior to joining Arizona State University, Dr. Reddy has held a variety of health policy and equity positions related to improving the health of low-income communities, particularly affecting women, children, and working families. Prior to the experience includes Harvard Medical School, Brigham and Women's Hospital, Women's Health and Policy and Advocacy Program, CASA at Columbia University, and the Children's Defense Fund in New York, the Texas Senate and Texas Health Institute, and the University of Texas School of Public Health. Dr. Reddy, do you sleep? Did you sleep? I can't even keep up.
I was just going to say my bio is obnoxiously long. I'm so sorry, everyone.
Hey, if anything, it just makes you more credible to talk about that today, right? So I will, due to time, I will go ahead and swap it over. Let's see here. We have some wonderful panelists. If you can show your lovely faces if you have not already. Let me go ahead and pin us. We're going to spotlight all of our panelists today. At the add spotlight and add spotlight. Okay, now I want to make sure that I get this correct, but I also have to recognize my own limitations. So please help me out here. I would like to introduce one of our first panelists. Am I saying this correctly when I say Lydia? Or Dr.
that's correct.
Rascon?
Yes,
Yes.
correct.
All right, progress. So Dr. Rascon is the director of the Global Health Collaboratory and Clinical Associate Professor. Let's see here, at the Edson College of Nursing and Health Innovation at ASU. She serves as the director of Global Health Collaboratory at Edson College, where she manages international partnerships and leads initiatives providing international and intercultural experiences for Edson College students such as study abroad. During her time at ASU, she has served as the co-director at Edson's Veterans Affairs Nursing Academic Partnership, as an originator and faculty director of the college's first study abroad program to Peru during 2016 and 17. As a Division I water polo athlete, impressive, Dr. Rascon has received her BSN from Hartwick College in New York, where she also minored in Spanish and completed her Master's of Science in Nursing Education at ASU in 2012. Dr. Rascon has practiced nursing in Kingston, Jamaica, Oaxaca, Mexico, Cusco, Peru, and the Solomon Islands, and locally in a free mobile clinic in the Phoenix Valley. Her clinical nursing experience includes work in oncology, medical, surgical, telemetry, medical ICU, trauma ICU, and community health. Dr. Rascon has completed her PhD in nursing at the University of Arizona and focuses her research on family-based interventions for diabetes prevention management in Latino communities. So thank you for joining us today. And then last but certainly not least, we have Anna Murphy. Anna Murphy is a clinical assistant professor at Barrett Honors College faculty in ASU Edson College of Nursing and Health Innovation. She's been practicing nursing for 39 years, and her passion in health promotion and disease prevention. This motivated her to pursue a Master's of Science degree and emphasis on community health nursing from ASU. Courses she has taught include nursing concepts in community and population health, transcultural health, along with many other courses in the pre-licensure nursing program. She also coordinates community health clinical rotations for Edson nursing students, where the experiences are focused on underserved communities. Professor Murphy's international experience includes a medical mission in Honduras and Spanish studies in Guadalajara, Mexico. Living, working, traveling in Spain and Europe for 2.5 years, she has been the co-faculty director of the Edson College Study Abroad program in Peru for the summers of 2018 and 19, and will be the co-faculty director for the same program in Kenya. Since the spring of 2020, she has been the faculty for the Barrett's Global Resolve Health Team, and in this role, she's been mentoring students from various disciplines to create meaningful health promotions, interventions in Naco, Mexico, primarily within diabetes prevention. Holy cow, we have quite the background, quite the knowledge in this space. So enough from me, but I will kick this off with asking the question. We've heard about your bio today, but what is it in particular about today's topic or panel that excited you to join us? I will go ahead and kick this off over to Anna. Since I introduced you last, you can kick it off first.
Well, I was motivated to be part of this panel because I find it an absolutely fascinating topic, that we can have such health disparities amongst the Latino population, Latinx population, but yet we can have better lifespans. You know, that to me is just an amazing phenomenon that occurs. And it speaks very loudly to me to what we call familismo in Spanish, you know, the strength, as you look at the different theories on why this occurs. And, you know, one of the things that really stuck out to me is that social network. And in nursing, we strive to be very holistic minded. And it just, to me, really, though it is one of the variables, there are many other variables involved, but that one kind of stuck out to me. Like, I live that culture. So to me, it makes so much sense, but to see it actually documented in data is, to me, fascinating. So that's why I chose to participate today.
Thank you. And so we will be going over a little bit more for those of you who have never heard about this phenomenon, this paradox, if you will. We'll go over it briefly here momentarily. Dr. Rascon, any contributions as to what excited you to be here today?
Well, I always love speaking with students and talking about health. And I think it's important that we look at health disparities, even something as isolated and specific as life expectancy, with an intersectional lens, with looking at all of the different factors that can affect someone's life expectancy and their health. So I think it's this specific topic really highlights a lot of intersecting issues that face health professionals. So yeah, I'm just excited to really dig into it and look at it from a lot of different perspectives.
That being said, Dr. Reddy, you are welcome to take the reins of this.
Wonderful. Thank you so much. And thank you for that wonderful introduction. It is great to be here with these wonderful panelists. And thanks for all of you for joining today. As we know, we are in Hispanic Heritage Month, the month of October. And you know, when I think about kind of why I was excited to talk about this topic today, it's really because as someone who studies and teaches in and is generally interested in health disparities, I find the concept of the Hispanic or Latino paradox to be a fascinating one, and maybe one in which we can learn more, learn some best practices, and maybe rethink the way that we consider life expectancy, longevity, especially for other marginalized populations or underserved populations. So that's why this topic is particularly interesting to me, specifically from that health disparities lens. So that being said, let's get started. What is the Hispanic or Latino paradox? Well, so we know that recent Hispanic and Latinx immigrants and Latino community members here in the US, although they're often poorer than their non-immigrant counterparts, tend to be healthier and live longer than the average American. They live longer, have lower rates of early death, in some cases, low rates of certain chronic diseases, despite being often less educated, earning less money, having the stress of adapting to a new country and a new language. In research circles, this is known as the Latino paradox. But as these communities are here longer, their health advantage seems to be eroding. So after 5 to 14 years in the US, they're 1.5 times more likely to have things like high blood pressure, obesity, than when they first arrived. Within one generation, the health is as poor as other Americans or of similar income status. So some researchers believe that most immigrants come to the US with something called a health advantage. Right? Migration selection. So even if their native country is poor, and that's because people who are able to move to another country usually are in good physical and mental health to begin with, have this thing called grit that is often underappreciated in immigrants. Many researchers believe another factor is at work, and that's very kind of specific to this particular community. Immigrants bring to this country aspects of culture, of tradition, traditional foods, tight family social networks, and community social networks that essentially form this kind of protective shield around them and allow them to withstand the negative impacts of American culture, especially those that impact low-income communities, and other negative social determinants of health. But that shield, those protective factors, seem to have an expiration date. The levels of all major mental disorders increased when we look at people who've been in the country for over 13 years. So you see these protective factors begin to wear down. One reason is low wages, working conditions, and increased social exclusion tend to break down those protective shields. Isolation is on the rise in the US, and we've certainly seen this during the pandemic. So what we're going to do today is try to better understand the Latino paradox and sort of the contributing factors, what sort of adds and hefts up that shield, those protective factors. What are the successes? What are the barriers? How can we use any of the lessons learned here for other communities that are experiencing health disparities? And better think about kind of social determinants of health. So with that being said, I'd like to kind of shift over to our panelists here. How do you think the social determinants of health are impacting the health of this particular community? What really sticks out to you here? And I guess I can just throw that out to the panelists and we can sort of just take turns chatting if that works for you all.
I saw you unmute first. Oh, okay. I saw Anna unmute first. I was going to let it go.
Sorry,
ahead.
yes.
No, I think when you look at someone's health and when you look at someone's health outcomes, it's important to look at culture, but there are so many different factors within that individual person, aside from and including their culture. And so when you look at the Latino population, we're not just looking at that. This is frankly one of my criticisms of the term Hispanic or Latino is we use that and we think we're covered. You know, we're looking at anybody south of the US-Mexico border is how a lot of people see that. And immediately there's a problem there, because there is not just one culture south of our border. There are countless subcultures. And I'm not just talking geographically, you know, there's Chilean culture and Peruvian culture, Colombian culture, Mexican culture. Even there are subcultures within that. Just like when we look at American culture, anybody from this country will tell you it's very, very different if you're in New York versus Southern California versus Arizona. So saying that Latino culture is X or is Y or is Z is already, in my opinion, a little oversimplified. And I think we have to look at, in addition to common threads in Latino cultures and Latino subcultures, in addition to those, we have to look at all of these other aspects that affect their day-to-day life. And by they, I mean, at this, again, this very vague pan-ethnicity label that has been put on this large group of people. But, you know, you look at things like rates of education and the grade in which the grade of level of education that the average Latino person has achieved, or the average income that a Latino person has achieved, or the safety of the neighborhood that that person lives in. And those are important factors as well. But again, it's each individual holds within them so many competing factors and so many dynamic components to consider that will not only impact their health, but everything else. And then obviously we can't deny the fact that racism has a huge impact on the experience of day-to-day life for Latino, our Latino communities in the United States. So this daily stress that someone may feel if they work in an industry or they live in an area where they constantly feel the effects of racism, that is going to affect their stress, their blood pressure, their willingness to seek out healthcare and feeling comfortable in accessing healthcare. So I think I just wanted to say on the outset that we have to keep in mind that you know, the term Hispanic and the term Latino, they also mean different things, but that we have to remember there's a lot of intricacy within that.
And that it goes for any of the cultures that we put everybody in under the white umbrella, and how many different subcultures are included in that white umbrella. And a lot of the data when we say Latino related to the Latino paradox is related, the majority of the data appears to be from the Mexican culture or the Mexican American culture, as opposed to, and so if you break that apart, the Puerto Rican culture tends to not have this advantage with life expectancy, but the other subcultures, like you were talking about, Dr. Rascon, do. So that's another piece that, again, you know, you have to look at, as we say, we always assess our clients individually, though they are part of a culture, we have to assess individuals. However, what we're talking about today is this phenomenon, right, that's occurring within this group of Latinos. And I agree with what other things can be impacting when you talk about the social determinants, their work areas, the stress of maybe physical labor type, work that puts more stress on their body physically, as well as the emotional stress that goes along with it. So many different things when you look at, for example, in the low income housing areas, which again, the data shows overall, Latinos are more in the lower socioeconomic group. What kind of foods are available to them? Are they living in food deserts? Our downtown Phoenix is essentially a food desert, and we have to, in our own community, bring in buses with food, fresh foods and vegetables, just to provide fresh fruits and vegetables to the people that live in the inner city Phoenix. However, we have, fries now that came into town, but it's still, a walking distance for many people. So looking at, again, all those social determinants and what's part of, is going to contribute to this decreasing advantage that we're seeing now as the generations acculturate more into the American culture. We're seeing that, as you were saying, Dr. Reddy, the decrease in that advantage, because of that, I believe, that acculturation, and that's what I believe is happening. I don't know.
Yeah, both of you make excellent points, and I really appreciate Dr. Rascon starting the conversation, establishing that similar to other minoritized groups, Hispanic and Latino communities are not a monolith, right? And so the experience of one sort of sub-community, subpopulation is not the same as all. That's a really important point, and I appreciate you making it. And you're right, Dr. Murphy, really, the paradox, it really focuses on Mexican immigrants and their offspring, certainly. So as we think about kind of the paradox and the pretty specific community that we are speaking about, how do we see members of this community interacting with the healthcare system? If we're talking about this paradox where, despite these other sort of factors like lower education, lower income, sometimes challenges with language, acculturation, et cetera, yet these longer lifespans, how are these individuals, how are these communities interacting with our healthcare system? Are they utilizing it more? Is there a high level of trust? What are your thoughts?
Well, I'll start. I mean, I think we can look at the research and we can look at our personal experiences. Professor Murphy and I are both Latina, and we have family members who some feel more comfortable and some feel less comfortable in different environments. But the research is showing that there is hesitancy to access the healthcare system from specific subpopulations. I have spoken with people who I'm very close to that don't really want to go to that place because I'm not familiar with it, and I don't know if I'm welcome there. And maybe they don't say that in so many words, but just that feeling of, going into a place where it's like everybody else is included and I'm the outsider. And then you're going to go there to access healthcare, to, be in a vulnerable place and to share, your health history and to seek help. I think another, frankly, stereotypical trait of many Latino subcommunities is this reverence and respect for healthcare professionals, to a point of, and I experienced this in some of my own research, where I would interview these Mexican-American women and ask them about their diabetes management. And rather than answer my questions, they wanted to give me the right answer. And they were interacting with me as a nurse and trying to tell me that they were doing everything correctly, instead of saying, I struggle with this, I struggle with this, I struggle with this. So I think a lot of times, one barrier sometimes that we see with some Latino communities accessing healthcare is this high level of respect for physicians, for nurses, for any healthcare professionals, but to a point where they're not going to necessarily share that I don't take my medication regularly, or I don't eat that kind of diet. But if you ask me, do I eat a lot of vegetables? Oh, yes, I eat a lot of vegetables. So I think it's really important to recognize that even if you are seeking healthcare, even if you are reaching out to healthcare professionals, and we see, our patients come to us, there's another layer there. Just because they tell us something, there's more to that story. So it's not even a point of just accessing healthcare, but how they interact with healthcare. I think a lot of times our healthcare systems say, oh, we have interpreters, or we have the flyer in English and Spanish, so we're done, right? We're culturally competent. And it's so much more than that. And I know I'll let Professor Murphy chime in, because I know that's a lot of times used as a proxy for, and now we're done. Now we are culturally relevant. Right. And it's so much more than that.
And competence, we're all,
the term competence.
Yeah, we Dr. Escoin and I, we work together pretty closely on different projects. And so we're always, discussing that term and how could anybody really be competent. I'm not even competent in my own culture. I'm always learning. But we like the term culturally humble, you're always wanting to be open to learning and actually admit that you aren't, culturally competent. And so we want to be sensitive to that. But yes, the experience of, as far as access to healthcare, it's so varied. You see anywhere from people that have immigrated and are able to navigate the healthcare system. But I, as a professional in healthcare for 39 years, still have trouble navigating the American healthcare system for myself and my own family. So I think a lot of you can relate to that. But I, for example, I just had a very dear friend who is an immigrant from Mexico who speaks little English. We had to send another one of our friends with her to the doctor. She has no insurance. My friend, who is, is native speaker Spanish, she's from Mexico, went with her to interpret. No way to pay, so those barriers are real, and they're there. And so I think you're going to see the whole continuum of well, I have insurance, I know how to do this, to I don't even know where to start. And unfortunately, that doesn't just go for the Latinos, that goes for a lot of Americans. I'm not going to say most, but a lot of Americans as well. So it definitely is a barrier for access to healthcare, and is documented, obviously in the Latino community, that it's a barrier to.
Yeah, absolutely. And so these barriers to access, whether they are physical barriers, whether insurance based, whether they're language based, whether they're as we, as you all are bringing up, really not necessarily talking about cultural competence. I don't like that term either, because it implies that somehow you can learn it and then you're done. Like you don't have to keep learning it, right? And so we try to use the term cultural humility as well. But all of these factors that are there and that continue to be barriers in many cases, we see that, yet we're still seeing in this paradox higher life expectancy, right? And in some cases, better health outcomes, which makes the paradox so fascinating. So let's talk a little bit about kind of these contributing factors, these successes, okay? So from your perspectives, what do you think are the most important aspects of that protective shield that we mentioned, right? Like the pieces that are acting as the really important protective factors that are shoring up that shield. In your opinion, what are they? Because I think they're really important to consider in terms of when they start dissipating, why they start dissipating. So what do you think are the most important sort of protective factors?
Well, I think, again, I was thinking about the sociocultural factors as well as faith, the spiritual side as well. But an interesting factor that I also think about is the diet. What we're talking about the indigenous perhaps diet, a plant-based diet, and Mexicans or Hispanics in the whole consume about 1/3 of the beans in the United States, because Hispanics being one of the larger populations, many times will eat beans for breakfast, lunch, and dinner. So it will be part of their breakfast, lunch, and dinner. And so legumes, lentils and beans have their low anti-inflammatory properties in them. So I was reading an article about the nutritional side of that. And I thought, as they acculturate and start to eat more of the processed foods, and then that's where, one of the reasons why we believe the increase in obesity and type 2 diabetes that we see in this population. But I think it's very interesting that between the diet and the strong social ties, the close-knit families, again, really, to me, speak volumes for those particular variables. So that's what I think are some super important pieces of that puzzle.
Yeah, and I'd have to agree. I think any culture can have people who eat the healthy foods, the healthy traditional foods, and the super unhealthy traditional foods, right? You can have, a fried taco, or you can have this really beautiful pico de gallo that's full of vegetables. You can have, along the spectrum of any culture, there's super healthy options and there's super unhealthy options. And I think that's a really interesting perspective on what are the healthy options, what are the healthy common threads of diet. But I think also within Latino communities, some Latino communities, you'll see multi-generational households, families who it's not common to just move out and live on your own. You stay with your family until you're married and then you move out. And maybe that's more traditional Mexican culture, but you still see that in the United States. And with my research with multi-generational households and specifically Mexican American women, they told me a lot of times in my research, I found that they reported saying, I want to set an example for my family. I'm not going to sit here and eat ice cream and, sit and watch TV when my grandkids are watching me. Like, I better eat some carrots, or I better eat some tomatoes, or we better go to the park. And so when you live in isolation, it's very easy to live a less structured lifestyle, to, nobody's holding you accountable, and so on and so forth. When you have these multi-generational households, somebody's like, come on, let's go for a walk. I don't really want to go for a walk. Nope, we're going for a walk. Okay, fine, I'll go. And your kids, normally I would just sit and watch TV. Well, they're outside running around. Okay, I'll go run around outside with them. So it's those subtleties. I think a lot of time protective factors, and really when you look at sustainable behavior change, it's not something that you learn from a 15-minute video or that you read in a pamphlet. Sustainable behavior change is what it happens in your day-to-day life that makes it that this is the easier option. And if you live in a busy household where, grandma's on a diet, so we're all on a diet, or, my daughter just came home from school and she learned about the Mediterranean diet, so we're all going to try this for a week or something. Those are the kinds of changes I think that can really protect a family in a sense when we're all in this together. Whether that's true to only Latinos or not, I don't think that's true. But I think when you have these close-knit families, like Professor Murphy was saying, you lean on each other. And when grandma ends up in the hospital, she's not there by herself. She's got somebody coming in to check on her. There's somebody else is stepping in to take care of the grandkids and so on. So you have all of that social support is so important, because life is not just linear. When something hits you, when somebody gets in a car accident, when somebody gets a scary diagnosis, when somebody has a roof leak and they have to move
They're
out,
there.
right?
They'll
They're
be
there to support you.
Support, right. And the other factor that seems to be very strong in the research is the less smoking. The rate of smoking in Latinos is less, and that comes out loud and clear in a lot of the articles and research related to this Latinx paradox. So.
Yeah, absolutely. I mean, so many interesting pieces there, when we're thinking about the protective factors of social support, and what multi-generational families kind of create. They create that social support, but then also all these other factors that tend to be really strong barriers for lower income populations, things like childcare, right? There's like built-in childcare. There's often, food security tends to be less of an issue in these sort of large multi-generational families, because there's, multiple incomes coming in, multiple sources of that food. Housing, because there's always sort of a home base to think of, right? And so the individual housing issue is less of a stressor. And even if language is an issue for one member of the family, there are other members of the family or other members of the community that can step in and help to navigate systems. So when we think about sort of what, say, an intergenerational, multi-generational family provides, we're really overcoming so many of the barriers that we know that folks, especially in low-income households in the United States, face, right? And childcare is one of those that I think is really under-examined. We don't think about it a whole lot, but what happens when you have safe, affordable, especially if it's free, right? Childcare, and what kind of opportunities does that provide, especially as families continue? Right. So really awesome points there. And, as I mentioned sort of at the top of our discussion, the really negative effects for health around loneliness and isolation, right? We know that isolation can kill. And we know that loneliness and isolation really contributes to negative mental health impacts. And we've certainly seen a lot of that during the pandemic. So, really comes back to the protective factors that having all of this social support does from a mental health perspective. And we know how sort of interconnected mental health is with other sort of physical health outcomes, right? So really important points there.
Well, can I just add
Please.
A little bit to that real quick? On the other end of the lifespan, caring for your elders. It's a phenomena that in the United States, we drive down the street and we see 5, long-term care centers, where I would ask my students who are from Mexico, so who takes care of your, elder? And they're like, oh, my mom, my uncle, my cousin. And he didn't even know, this was 8 years ago, he didn't even know where there was a nursing home anywhere near his home. I know that it's getting more popular, but again, caring for your elders, they keep them home with them and they take care of them in that regard. So, on that one end of the spectrum or the life continuum, you're talking about childcare, but on the other end, keeping that intergenerational, there within the family and the support. And they're very proud of that. They're very proud that they,
Absolutely. No, and generational wisdom that comes with that, right? And the support that comes with that, and sort of the cultural wisdom and passing down of traditions, et cetera, that comes with that. Sorry, Dr. Ruscone, you're about to say?
Oh, no, I was just going to say, from personal experience. So my father's Colombian, and his mother lived with my parents for 10, 11 years, and nursing home wasn't even on the table. It's not even discussed. It's not like, well, that's option A and this is option B. It's, you don't do that. And that's, another different Latino culture. And same thing with my family now, like that's not even an option for us, is to, send an elderly person to a nursing home. So I think Absolutely. It's if we're looking at life expectancy as our main outcome here, if we're looking at that in terms of a paradox, that potentially could explain a lot of it. Is that, you know, you send somebody to a nursing home and right away they are at risk for a constellation of complications, right? Every type of infection, bed sore, isolation, depression, dementia, et cetera. And so if you're keeping our older population out of that environment right away, that's a benefit on its own.
Yeah, absolutely. And, you know, and I'm thinking also keeping sort of our elderly family members at home, lots of really important research on that continuing sort of purpose in their lives, in their day, waking up, knowing that at minimum there's a purpose in terms of taking care of younger family members, being there for other members of the family, whether it's childcare, whether it's, you know, food, social support, work, whatever the case is. A lot to be said about sort of the health benefits of having a maintained purpose, right? Even later in your life. I want to come back to food for a second, because such an important one. And lots of research in the Latino Paradox space about the protective factors of traditional foods. And when we think about many of these immigrants, we're really talking about immigrants that overwhelmingly, especially from Mexico, that overwhelmingly came from not necessarily highly resourced backgrounds, and that when they're coming into the United States, not initially having particularly highly resourced existences here in the US either. Yet something about sort of the traditional diet seems to be serving as an important protective factor. Can we speak about that a little bit and kind of what we need to better understand about that traditional diet? You mentioned sort of the consumption of beans and the importance of that, and also plants. Can we discuss that just a little bit more?
Well, I think when we say traditional diet, I don't think any culture's traditional diet is processed food.
Right.
You know, that's something that we have created, and is not, I mean, it has kind of become our culture. I think when you look at traditional diet from, you know, for instance, in Mexico, I lived in southern Mexico for a little while, and, you know, you are grinding the corn for those tortillas, and you are, the vegetables are locally sourced, and there's, you know, a labor that goes into creating this food. You know, Native Americans, same things. Fry bread was not one of their traditional foods. That was the result of you know, some very ugly history that we have. But I think if you look at, you know, these traditional, natural, from the earth foods that began with specific Latino cultures, and then you come to fast-paced United States where I don't have time for lunch, I'm going to eat a granola bar, and then I'm going to be really hungry, and then I'm going to have a 3,000 calorie dinner. Like, that is what our culture, some of our culture has become, is this culture of convenience, and I don't have time to cook. And so I'm just going to get whatever's easiest for me. So I think, yeah, from the traditional foods, a lot of people think, oh, Mexican food is very unhealthy. And actually, a lot of the women I interviewed told me, oh yeah, our food is really unhealthy. That's why we all have diabetes. And I would hear that a lot. And I would realize, you know, they were talking about, you know, tacos dorados, and they were talking about, you know, fried foods and high fat foods. But when you look at what those foods used to be, or what they traditionally are, either A, it was the same food, but that was after working for hours and hours and hours, or before working for hours and hours and hours. So I think it's not the food itself also, but the context of when somebody eats that food. Do you eat that food and then sit at your office, or do you eat that food and then go physically work for hours? So
yeah, absolutely. And so when we're talking about sort of that, the role of processed food, and sort of the, you know, starting to begin this conversation on those protective factors dissipating over time. Let's talk about that a little bit. How do you think those protective factors have deteriorated or are deteriorating over time, especially, and sort of, I think the most striking piece here on the paradox is it feels like as the generations become more Americanized, many of those protective factors start fading away. The shield starts getting a little bit weaker. Can we speak about that a little bit?
Well, I think that when you talk about that change in diet, so they were with basically plant-based diet, then they come to the United States and they live in a food desert where all you see, if you do a windshield survey, all you see is our fast food places to go. So then they go there because it's inexpensive and easy, like you're saying, talking about convenience. And then they start to gain weight. And so now we have our obesity problem that is very prevalent. And I believe Mexico just surpassed the United States in their obesity, in the incidence of in prevalence of obesity. So, just that change in diet, it's a whole different metabolism that's kicked in. And I think we all wonder, what is it about that then that has kicked us into this epidemic of type 2 diabetes? Their bodies just can't handle this processed food, this drastic change in what they were used to. So I think health-wise, the obesity and inactivity that unfortunately is prevalent in the American culture, just in general, all of us, is really going to be harsh on that shield that they started with that nice, healthy, plant-based diet. And that goes for everybody. That goes for all of us. So.
And I would say too, I mean, I've been thinking about this a lot lately too, is employment. And like you were saying, Dr. Reddy, childcare, like those kinds of factors over time, how many brown people are in high paying jobs in leadership? There's not very many of us. And if you look at the demographics of Latino people in lower paying jobs as compared to higher paying jobs, it's clear that the higher paying jobs are basically Latino people are less likely to get those higher paying jobs. The reasons for that are multifaceted, of course. But if you look at that, then you're looking at, okay, well, if I don't have a higher paying job, then maybe I need 2 jobs, or maybe I have to work longer hours. And because I have those longer hours, I'm exhausted. I don't want to, go exercise, or, I'm exhausted. I don't really want to eat that salad right now. I want a hamburger. So over time, as work conditions are less healthy, and then if someone's kids are watching them go through that and adopting those behaviors, it starts to, it's the
acculturation to what, we as an American culture, we're busy, we're stressed. It's a different stress for them. The stress you're describing is a different stress than maybe they didn't have in the past, and affects them in a much stronger way, perhaps. So stress is huge.
Yeah, absolutely. I mean, really great points there about the kind of the acculturation piece, but also the impacts, the sort of social, economic, and systemic barriers that are obviously felt by members of this community, but disproportionately experienced by minoritized communities all over this country. And it feels like those experiences start becoming more and more and more of the reality of this particular community as generations progress in the United States. I think that's probably a good description there. And I'm looking at the time. I feel like we can chat about this all day and all night, but I'm looking at the time, and I think that it's probably a good time to reach out and see if any of our friends that have joined us have any questions or comments. And I might need some help moderating that piece, Mercedes. But if anyone has any questions or comments for any of the panelists, or want to share your personal experiences or family experiences, we'd love to hear from them. And while we wait till folks jump on, I wanted to ask you all about your own kind of experiences with your family, and how this particular paradox and the protective factors, can you relate to any of these protective factors? Do these feel familiar to you, and did they feel like protective factors to you?
Well, for me, absolutely. As we were discussing the family bond, there was absolutely, I could just feel myself getting, riled up, because there is absolutely no way that the discussion of putting my mother and father in a long-term care center, that was absolutely not going to happen. And he lived he was 94. My father was 94 when he passed, with a chronic, heart failure, and just all of us being around to take care of him, we allowed him to be independent for most of that time till the very end. So for sure, that social bond and the value of the elder in our family was huge. So that one definitely speaks to me, and knowing that I just really believe that people need that social network to be healthy, right? To maintain their health, and that support system for your times of stress. So for me, that was the one that really was profound. I just feel like that's not even, don't even talk to me about putting my father in a nurse. There's no way that was going to happen,
Right.
So.
Yeah, absolutely. I mean, I think I shared about how that's the case for my family as well. And I think, growing up, hearing you talk about grit, Dr. Reddy, I would hear stories about my dad, and I don't have
Yes.
permission to tell all of his stories, but there were stories of him not having shoes, and of him, being hungry and coming to the States, not having anything and knowing English and not knowing any English. And here I am, in school complaining about a math assignment, like right away. It would help me put things in perspective really quickly. And I remember going to Colombia when I was 10 years old, and I'll never forget that trip. And coming out of the airport and seeing 10, 15 guys sitting on the airport with machine guns, on top of the airport roof with machine guns, just walking through there and just taking it in and thinking, like, this is where I come from. This is, my culture. These are my people. And we would go and see family, and just the fierce love that you would feel, where people who I had never met in my life when I went there for the first time. And you just felt like you're like, these are my people, period. And there was nothing conditional about it. And yeah, I think that social support and that sense of love, frankly, helps families be more resilient and feeds that grit when things are hard, or you feel like you're the only one in a PhD program that has ever done this before, and you're a hugely imposter syndrome child, right? So I think that happened a lot for me, where nobody in my family had a graduate degree, and I'm first generation American on one side, and I'm like, I don't belong here. But then I remember these talks that I would have from my dad and the things that he had been through, and thinking, okay, this is too bad. You're just going to have to push through this. And so, yeah, I think as we have these multi-generational households, as we have these close-knit families, and we share our stories and we share our strengths, I think that's a resource. That's something that you can really feed from generations down the line.
Yeah, absolutely. As I'm hearing you all speak, my family immigrated from India. My parents are immigrants. My entire extended family here, we're a close-knit immigrant family. And there's so many similarities that I'm hearing, right? I'm hearing so many similarities about diet. I grew up on a traditionally Indian, vegetarian, home cooked food diet. Now I'm unfortunately not providing that to my own kids anymore. That's already dissipated.
I know, there you go.
It's already dissipated. But our diet was very specific. The social supports were very specific. The sort of sense of community, multi-generational appreciation, all of that was very specific. And I think often when we're young and we're growing up, we don't necessarily see the protective factors of all of that, but gosh, I see it now. I really do see it now. And you see what happens. And I think the pandemic is a great case study when we don't have a lot of that, when we don't have the social supports, when we are feeling isolation, how lucky we were to have that. And Mercedes, I see that you might have a question or a comment for the group as well.
Yeah. So let me tell you, I've just been like nodding in my office this entire time. I tell people I'm half Puerto Rican, half everything else. And which has given me like a lot of space for thought and negotiation in regard to culture. And now that I'm in the US in comparison to my grandparents, like how I want to move forward with culture. And so I'm thinking about 18-year-old Mercedes when she came to ASU as an undergrad, right? And she's learning all of these new concepts, first gen, like trying to go back home and put family on game or bring them up to speed as to the things that I'm learning, right? But we also know for many of our first gen students or students who are ni aquí, ni allá, like straddling the fence of their own culture and the information that they're learning, how do you deliver this in a way that doesn't come off as, oh, you're too good, or you're learning all these things and all of a sudden you're smarter than us, right? Like there's a weird shift that occurs for many of our students that are one foot in this door and one foot at home.
That's a tough
just
one.
thoughts.
Yeah, no, that's definitely a tough one, because I think we've all experienced that. Though I'm older than you all, all my grandparents came in from Mexico. So I'm second generation. My parents are first. And I think we all feel that, if we don't want to come in and say, look at me, I know all this stuff. And I'm like, I'm not really from Mexico. I'm not, it's just, it puts you in, but yet you're proud and you don't know where you fit in. So it is very difficult. And honestly, I don't know how to really answer that one, because I think we're all still trying to figure that out, and how we are all, and I see Dr. Reddy too. I'm sure you feel the exact same thing. On one hand, you're too American. On the other hand, you're too Mexican. Which one are you? It puts you in a real interesting position. But I think you just have to navigate that and find out what works for you. I don't know. Lydia, what do you have to say? No, that's a tough one to.
No, I think it's such an important position to be in. It's hard. Oh my goodness, it is hard, because in one environment you feel less than, and in the other environment you feel like everybody thinks you're too good for them. And one of the biggest challenges that we have in academia, in science, and research is we stay in our little bubble of everybody who looks and thinks and acts like us and talks like us. And we're studying these people who we don't even speak their language anymore. We can't identify with them anymore. And this is like, the pandemic has been the perfect exemplar of this, where we've done all of this research to create these vaccines, to do this, and we try to share that with the world, and we don't make any sense, and we're better than everybody. So I'm not going to buy into that in a sense. When we have individuals who straddle both worlds, they need to keep straddling both worlds. I think, you can't say, well, I don't want to feel like I'm too good for everybody, so I'm going to go back over here and forget everything I've learned, or, well, I'm better than you now, so I'm going to stay over here. You have to keep a foot in both worlds, because those two worlds are not merged as well as they need to be. And we don't talk to each other anymore. And this is why things like scholarships, I think, are so important, because now you have students who have lived and breathed and spoken this world for so long, now learning, about the latest science, and also telling the scientists what's what, and saying, that's not actually how it is. I don't know how many times my Mexican family has said, what is this familismo you're talking about? We don't say that. Or what is, even saying Latinx, they're like, nobody uses that. What are you talking about?
Right. They don't, that's our term. Right.
It's the terminology we use as elite academics.
Right.
And then what about the people we're actually claiming to care about? So I think it's really important that if you are in both worlds, it's difficult, but I don't think you pick one or the other. I think you have to maintain connections in both, and we need to bridge those more.
Yeah, I 100% agree. I've learned that it's like the little nuggets where I can find my in with my family that I'm like, oh, guess what I read about? Or have you tried this? Like, I learned this in a study somewhere and I got really excited. But doing it in small doses is what I think got me through that transitional period where my family was like, okay, she might know a thing or two. We'll give her some credit. But I'm looking at the time. We are just minutes away from 3:00, and I know many of our students have classes or other things to get to. So we'll go ahead and wrap up here at this point. Thank you so much to everyone on our panel today. Dr. Reddy, thank you so much for moderating this discussion. I hope all of you got a lot out of it. I know that I enjoyed this session today. And so I'm looking forward to future iterations of what health disparities looks like, or ethics and mindfulness in healthcare. We'll get back to you all on more details on what that's going to look like. Right now, thank you so much for joining us. Thank you so much for your contributions today. For the rest of our attendees in this session, I will go ahead and follow up everyone with links to our YouTube channel. So if you missed something or you want to share this on with your colleagues, classmates, family, whoever it might be, you can do so. We'll keep this accessible to all and our community members. If you need proof of attendance for a class assignment or anything like that, I will make sure to get out those details to all of our college partners and our departmental partners. And if you are interested in more events coming from the College of Health Solutions, Barrett the Honors College, or Edson College of Nursing and Health Innovation, please know that I will also follow up with the links to all of our student activities calendars so that you can stay in the knowledge loop of what we're doing here on out. That being said, thank you so much for joining us, and we are wishing you a wonderful rest of your day, and have a great, what is homecoming week this week, right? So happy Halloween, happy homecoming if you celebrate. In the meantime, take care. Thank you, everybody.
Thank you.
Thank you.
Thank you, Yesenia.
Thanks all. Thanks to the team.
Yeah, thank you guys. It's a
Thank
pleasure.
you.